My name is Elizabeth Bowen, and I'm going to talk to you a little bit about squamous cell carcinoma and malignant carcinoma. Squamous cell carcinoma accounts for approximately 20% of non-melanoma diagnosed skin cancer. It is also more likely to metastasize than basal cell carcinoma, and this type of cancer appears in the epidermis. It is reddish in color, rough, thick, has scaly lesions, and it sometimes bleeds, and there's more inflammation than in basal cell carcinoma. And it may appear as leukoplakia, which is a pre-malignancy of the mucous membranes. It is most commonly found on sun-exposed areas such as the lips, ears, head, neck, and the back of the hands. And in 2012, there were over 700,000 cases diagnosed annually, and between 3,900 and 8,800 people died from the disease during that time. Outcomes are best when the carcinoma is found early, and it also depends on the spread of the tumor. Treatment for squamous cell carcinoma includes Mohs micrographic surgery, which has a 94 to 99% cure rate, excisional surgery, which has a 92% cure rate, but drops to 77% with a recurrence of squamous cell carcinoma. And electrosurgery has a 92% cure rate. Cryosurgery is lower than surgical. Radiation has an 85 to 95% cure rate. Photodynamic therapy is not FDA approved for squamous cell carcinoma, and the cure rate is not known. Laser surgery is also not approved by the FDA for squamous cell carcinoma. Topical medications are successful with Bowen's disease, but they're not for the invasive. Diagnosis and management of basal cell carcinoma and squamous cell carcinoma. Small tumors of the basal or squamous cell type cells are diagnosed through curettage and electrodesiccation of the tumor. Mohs surgery is indicated for larger lesions or lesions that are close or near facial features and ears. And radiation therapy may be indicated for malignancies. Other types of treatments include topical medications such as Fluorosil, which is an immune response modifier, or photodynamic therapy. For history of malignant melanoma, evidence exists to suggest that melanoma can be dated back 2,400 years ago. John Hunter was the first surgeon to operate on melanoma in 1787, and in 1804, René Laennec first described melanoma in a lecture for the Faculté de Médecine de Paris. In 1956, Professor Henry Oliver Lancaster discovered melanomas to be directly associated with sun exposure. Malignant melanoma is a cancer of the melanocyte and is highly likely to metastasize. In the early stages of the disease, it is difficult to diagnose because of the changes of the skin are minimal. This is called melanoma in situ. There are 4 types of malignant melanoma: superficial spreading melanoma, nodular melanoma, lentigo melanoma, and acrolenticus melanoma. It can appear anywhere on the body, is most frequently seen on the legs, arms, and the trunk or the torso. And it also has been seen under the fingernail and toenails, on the palms, the soles, tips of the fingers and toes, and on the mucous membranes. Bleeding can be a sign of advanced melanoma. The first warning sign of malignant melanoma is a change in the size, shape, color, or feel of a mole. The ABCDE rule is always helpful to remember for the warning signs of melanoma. A is for symmetry. The shape of one half of the mole does not match the other. B is for border. The edges are ragged, notched, uneven, or blurred. C is for color. Have different shades such as black, brown, and tan, and also areas of white, gray, red, or blue may also be seen. D is for diameter. It's usually larger than 6 millimeters or is growing in size. E is for evolving. The mole or lesion is changing in size, shape, color, and overall appearance. Melanoma usually does not cause pain, although oozing, bleeding, and texture changes may occur. Superficial spreading melanoma is the most common type of melanoma. Its characteristics include margins that may be flat or elevated and palpable. Irregular borders, can be circular, and it may have a combination of colors such as tan, brown, black, gray, bluish black, white, or pink. And it appears mostly in middle-aged population and can be seen on any part of the body.